This is 7 National News, and in our top story, a 623-page plan for Dubai's Expo 2020 bid has been revealed to the public that covers the budget, transport, safety and entertainment, to name a few, at the 438-hectare site in Jebel Ali. The Dubai Expo bid document was given to the World Expo supervisor, Bureau d'International des Expositions, in November. And it's been revealed that as a part of the entertainment, a pageant will showcase 50 years of the UAE, as it will hopefully coincide with the 50th anniversary of the foundation of the country. Additional plans for concerts, water displays, fireworks and parades were also revealed to cater to every type of visitor, which are to continue after the Expo Pavilion's close. The proposal shows that no less than 63 events will be showcased every day, starting at 10:30 a.m. and ending at 11:30 p.m. Dubai is one of the 5 cities bidding to host the Expo 2020, and the winner will be named and announced in November. Patients, healthcare professionals and social workers of Dubai's Thalassemia Centre will soon be embarking on a 5-day road trip across the UAE as a part of the Dubai Health Authority's Help campaign, which was launched today. An MOU was signed this morning between a local charity, Beit Al Khair, and the DHA to establish a bank account that will collect funds for thalassemia patients. Dr. Kaula Belhaul, the centre's director, stated that the disease bears several non-medical complications, adding that the treatment costs involved are lifelong and can be detrimental to the entire family in the future. Currently, the centre supports 840 patients in the UAE, where the carrier rate varies from 4 to 8%. In areas such as Turkey and India, the carrier rate can reach up to 12%, according to Belhaul. The team will start their journey on Tuesday, visiting thalassemia patients in Fujairah, and will stop over in Ras Al Khaimah, Al Ain, and at the end, the Sheikh Khalifa Hospital in Abu Dhabi. Throughout the trip, healthcare professionals aspire to raise awareness, improve conditions for current patients, in addition to encouraging screening for the disease, which will help reduce the incidence rates.
The idea is really to go across the Emirates, meet the patient, and try to define their non-medical needs and try to provide the support for them to overcome these challenges in their life, and so that at the end we can reach the medical outcome that we want for these patients. This is the main idea of the whole campaign. But I hope like in 4 years' time we will be able to cover all the financial needs of all the patients with thalassemia in UAE. So, in fact, my target is 100% support. But I hope I can achieve this target.
At the conference, His Excellency Engineer Essa Al-Haj Al-Maidor, the Director General of the DHA, spoke on behalf of a 30-year-old patient who gave his opinion on the Help campaign.
He's a 30-year-old patient of the center, and he's happy with what he has received, and he is proud of it. And he said, please don't forget us. As you are moving with the new ones, don't forget the old ones. So that's what they have expressed. Actually, the how to face thalassemia or any genetic diseases is with awareness, with the protection. If we consider that from the beginning, both the wife and the husband make sure that they think with mind, not only with hearts, that makes the generation in the future more happier. Even the family, when there is any member has similar type of disease, the whole family suffers actually. So we hope and we wish that they consider that in mind, and that prevent the society and the family in particular.
According to the World Health Organization, depression is the second leading cause of disability in the world and costs governments billions of dollars in lack of productivity. Depression and anxiety are very real threats to an individual's life and the economy, according to experts at the Treatment of Mood and Anxiety Disorders Middle East Perspective and Guidelines. the CanMat International Conference on Treatment of Mood and Anxiety Disorders and the MENMAT Middle East Network of Mood and Anxiety Treatment have come together to provide physicians, particularly psychiatrists, a common platform for the first time in the region. The Congress explored areas including biological, genetic, metabolic, pharmacological and cultural differences in the Middle East.
Depression and anxiety is much more common in women than men, but it doesn't really mean that men are not afflicted. And it does not identify one nationality versus the other. The lifetime prevalence in every country in the world is approximately 17%. The reason we have selected the CanMat, those are my group from Toronto, from the old days when I trained in Toronto, is because they have created one of the best guidelines in the world. And without having a guideline, physicians tend to prescribe in a very erratic way. And we need to establish a guideline for people to write medication appropriately, especially with drugs of addiction that are commonly used, like anxiolytic, Valium, Xanax, Lexotanil. These are dangerous drugs to prescribe for a long period of time. We need to establish that this medication will be used following a guideline, following a very restrictive guideline. The major contributing factor for depression and anxiety is genetics. It runs in families, but also life stressors can enhance or worsen the situation of depression, make it come on the surface. And of course, young people moving to a new country, trying to establish an identity, trying to earn a living, worried about unemployment. All these are stressors that can bring the anxiety and the depression on the surface.
According to organisers, while the numbers of sufferers across the region are similar to numbers worldwide, it is time to change the practice of looking at the West to provide guidelines to treat the population here, given the mixed diversity and other factors. The event provided experts the tools and in-depth learning experiences with an aim to improve patient care for a better outcome.
We in Canada have developed a group called the Canadian Network for Mood and Anxiety Treatment. So we've developed guidelines, we've worked as a group in terms of clinical evaluation of new treatments, and we're delighted to be able to share this knowledge with a large number of physicians, mostly psychiatrists from across the Middle East, so that they may benefit from some of our expertise. And the challenge for us is to know what kind of depression people have. We really don't have the kind of laboratory markers that we would like to be able to make diagnoses. So we have a number of different treatments that work on different systems. We understand that there are brain circuits that influence our mood, how we feel in terms of sadness, happiness, fear, disgust, all these different emotions. And so the challenge is to know which treatments are working best for which individual.
The Consumer Protection Department at the Ministry of Economy will meet with representatives of major sales outlets in the UAE this week, with the hope of bringing a 30% drop in prices for Ramadan-related goods this year. The director of the Ministry of Consumer Protection Department, Dr. Hashim Al-Nuaimi, was quoted as saying that the ministry is planning to offer various purchasing options for consumers, including the Ramadan goods basket, special offers, the fixed price initiative, and a selling at cost price initiative. He added that he expects prices of Ramadan-related commodities to remain stable, with Ramadan baskets at a similar range as last year, between 100 and 200 dirhams per basket. Al-Nuaimi also revealed that the field tours the ministry will pay across the country are aimed at establishing how ready shopping centres will be during Ramadan this July. New cycle tracks for Dubai across 11 locations in the Emirate have been launched that will stretch 52 kilometres and at a total cost of 40 million dirhams. That's according to the Road and Transport Authority. According to the reports, the RTA is currently building a 4.5-kilometre long track in Dubai and has completed the designs of 4 tracks linking Jumeirah Road with 4 metro stations on the Sheikh Zayed Road. Additionally, the authority has completed the construction of 1,400 bike racks around all metro stations. According to His Excellency Mata Al-Taya, the chairman of the board and executive director of the RTA, Residential areas like Al Barsha, Al Kawanij, Al Waka, Al Kuz, Al Sufur Road, Al Mamzar Park, Mushrif Park and Murdif have been selected for the project. Work on the new cycling tracks will begin this year to be completed by 2016. The Department of Traffic and Patrols at Abu Dhabi Police is set to install 8 new radars at the Al Ittihad Ring Road in Al Ain today. The move is a part of the traffic safety plan to install 57 new radars at the international roads and highways in Al Ain. The radar detection speed at Al Ittihad Road has been specified at 141 kilometres per hour, which looks to help prevent traffic accidents. And additionally, pedestrian fatality accidents in Abu Dhabi dropped by 14% during 2012, following traffic police campaigns to ensure road safety and the cooperation shown by motorists and pedestrians, according to officials. Colonel Hamad Mubarak Al-Meri, the director of Abu Dhabi Traffic Police, said that 2012 saw 3,588 tickets issued for jaywalking and 983 tickets for motorists who parked their vehicles in pedestrian crossings. He added that a master plan for pedestrian crossings is being developed with 20 additional pedestrian suspension bridges in Abu Dhabi, 2 in Al Ain and 4 in the western region, in addition to fences on main roads. And finally, in an effort to further promote good reading habits among primary school students in government schools, across 11 countries in the Middle East, the Kids Read initiative currently involves 5,000 school children, 6 supervisors, and 55 teachers. Involving parents and the community is the goal of Kids Read, an award-winning programme which encourages primary students to read for pleasure inside and outside of the classroom. Organised between the Ministry of Education, the British Council and HSBC, it saw a successful pilot run last year. They added that they surpassed last year's number of participants, where more than 2,000 children enjoyed learning with their parents. The programme touches on several topics such as art and culture, the environment, as well as volunteerism and helping others. And because it is never too early to learn about financial management, this year also focuses on the value of money.
We've gone from about 2,500 kids last year to 5,000 this year, and we are aiming to have at least 400 people for the community events in the British Council. So a big growth from last year, really big growth. Research in the UK has shown that the most significant factor in the success of children in school is parental involvement. And that's something that parents often find quite scary. It's like, how do I help my child? When actually a lot of it's very simple. So that's what we want to do with these workshops. Whatever the theme is for the kids, the important thing is to give parents a few little tips of how they can get involved with their kids' education. And a lot of it is just being there together.
Parents living in the United Arab Emirates have very busy lives, and primarily revolving around earning that money. They tend to find a challenge with their children. And we've all heard the anecdotes and the stories of, well, mummy, just go to that machine in the wall and get money from there, or just use plastic. They need to start learning as early as possible what the value of money actually is, how it's earned, and how best to spend it and to save it.
Free and open to the public, the event consists of storytelling as well as arts and crafts. The British Council says that through this, they aim to encourage parents to take active roles in their children's education and engage the community.
From time to time, you need to go for such workshop that add to you, motivate you, enrich your ideas. So it's the first time I receive an invitation for kids, and I really like it. I do agree that reading is very important, and we have a problem. Kids don't really read. My kids, fortunately, they like reading. Okay? So I just want to listen to their feedback after the workshop, what they come up of this workshop. And I think it's going to be really useful for them.